Citalopram Hbr is a medication used to treat depression. It may help improve your energy level and feelings of well-being by restoring the balance of a certain natural substance, serotonin, in the brain. It is known as a selective serotonin reuptake inhibitor, SSRI. The usual recommended daily dosage is 20 to 40 mg, taken once a day. It can be taken with or without food, but it is important to take it at the same time each day. It may take several weeks before you feel the full benefit of this medication. Before taking citalopram, make sure to read the medication guide and, if available, the patient information leaflet provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. You can take this medication with or without food, as directed by your doctor, usually once daily in the morning or evening. The dosage will be based on your medical condition, response to treatment, age, lab tests, and other medications you may be taking. Be sure to tell your doctor and pharmacist about all the products you use. If you are using the liquid form of this medication, be sure to carefully measure the dose using a special measuring device/spoon. Do not use a household spoon because you may not get the correct dose. To reduce your risk of side effects, your doctor may direct you to start taking this drug at a low dose and gradually increase your dose. Be sure to follow your doctor's instructions carefully. Do not increase your dose or use this drug more often or for longer than prescribed. Take this medication regularly at the same time each day to get the most benefit from it. Keep taking this medication even if you feel well. Do not stop taking this medication without consulting your doctor, as some conditions may become worse when this drug is suddenly stopped. It may take 1 to 4 weeks to feel a benefit from this drug and up to several weeks before you get the full benefit. Be sure to tell your doctor if your condition does not improve or if it worsens. Some common side effects of citalopram Hbr include nausea, dry mouth, loss of appetite, tiredness, drowsiness, sweating, blurred vision, and yawning. However, many people using this medication do not experience serious side effects. It's important to tell your doctor if you experience shaking, decreased interest in sex, changes in sexual ability, easy bleeding/bruising, fainting, fast/irregular heartbeat, black stools, vomit that looks like coffee grounds, seizures, eye pain/swelling/redness, widened pupils, vision changes, or any of the symptoms of serotonin syndrome/toxicity. Males may also rarely experience a painful or prolonged erection lasting 4 or more hours, which requires immediate medical attention. Additionally, it's important to seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. Remember, this is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed here. When it comes to treating conditions like depression and other mental/mood disorders, medications like citalopram Hbr can be really helpful. They can even prevent suicidal thoughts and provide other important benefits. However, it's important to note that some people, especially those younger than 25, may experience worsening depression or other mental/mood symptoms when taking antidepressants. That's why it's crucial to talk to your doctor about the risks and benefits of taking this medication, especially if you're younger than 25. If you do decide to take citalopram Hbr, it's important to pay attention to any changes in your mood or behavior. If you notice any worsening depression, unusual behavior changes, or new anxiety, panic attacks, or trouble sleeping, make sure to talk to your doctor right away. This is especially important when you start taking a new antidepressant or when your dose is changed. Remember, it's important to be honest with your doctor about how you're feeling when taking this medication. And always follow your doctor's instructions on the best time to take it and the right dosage for you. Before taking citalopram Hbr, make sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. It is also important to discuss your medical history, especially if you have a history of bipolar disorder, liver disease, seizures, or certain heart conditions. Citalopram may affect the heart rhythm and could potentially cause serious symptoms that require immediate medical attention. The risk of this condition may be increased if you have certain medical conditions or are taking other drugs that can also affect the heart rhythm. It's important to talk to your doctor about any concerns and to use citalopram safely. This medication may cause drowsiness or blurred vision, and alcohol or marijuana can intensify these effects. It's important to avoid driving or using machinery until you can do so safely. Additionally, if you are planning to have surgery, make sure to inform your doctor about all the medications and herbal products you are using. If you are an older adult, you may be more sensitive to the side effects of this drug, and it's important to be aware of the risk of falling. Children may also be more sensitive to the side effects, especially loss of appetite and weight loss. During pregnancy, the use of citalopram should only be considered if clearly needed, as it may harm an unborn baby. It's important to discuss the benefits and risks with your doctor if you are planning or think you may be pregnant. This medication can also pass into breast milk and may have undesirable effects on a nursing infant, so it's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions when taking citalopram Hbr. Other medications may change how citalopram Hbr works or increase the risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Some products that may interact with citalopram Hbr include other drugs that can cause bleeding/bruising, aspirin, MAO inhibitors, and other drugs that increase serotonin. It's important to also be cautious of products that cause drowsiness, as well as other medications that may affect the heart rhythm. Additionally, be aware that citalopram Hbr may interfere with certain medical/lab tests, potentially causing false results. Always consult with your doctor or pharmacist before starting, stopping, or changing the dosage of any medicines. If someone has taken too much citalopram Hbr and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It's important not to share this medication with anyone else. Make sure to go for any necessary medical tests, like EKG, while you're taking this medication. And be sure to keep all your medical and lab appointments. If you have any questions, consult your doctor for more details. If you forget to take a dose of citalopram Hbr, you can take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at the regular time. Don't take a double dose to make up for the missed one. Remember to store your citalopram Hbr at room temperature, away from light and moisture. It's important not to keep it in the bathroom and to keep it out of reach of children and pets. When you no longer need your medication or it has expired, make sure to properly discard it. Do not flush it down the toilet or pour it down the drain unless instructed to do so. You can consult your pharmacist or local waste disposal company for the best way to dispose of it. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.